Hello, and welcome to the third TUH University Hospital podcast series of Let's Talk About. In this series, we are going to talk about Down syndrome. You will find this and our previous series on the hospital YouTube channel, Facebook page, Apple Podcasts, and Podbean. Each episode is targeted at individuals with Down syndrome, their families and carers, health and social care staff, and anybody who has an interest in the health needs of adults with Down syndrome in Ireland. We will speak with experts from Down Syndrome Ireland, Children's Health Ireland, the Intellectual Disability Supplement to the Irish Longitudinal Study on Ageing, known as IDS-TILDA, and our own expert speakers in intellectual disability and the National Intellectual Disability Memory Service in TUH University Hospital. Hello, my name is Geraldine Kyle and I'm a registered nurse tutor at TUH University Hospital and a mother of a young adult with Down syndrome. In this second episode of the Let's Talk About Down Syndrome podcast series, I'm delighted to welcome Fiona McGrane. Fiona is clinical nurse specialist in Down syndrome working in Children's Health Ireland at TUH. Welcome, Fiona.
Thanks, Ger.
Fiona, could you tell us a little bit about your role in Children's Health Ireland?
My role is I am the National Clinical Nurse Specialist for Children with Down Syndrome. So I'm based at CHI at TUH, and I receive referrals from across the country of new babies that are born with Down syndrome, and also in relation to any medical queries that parents have. And I'm also involved with the Down syndrome clinic that we run here at CHI TUH. We have about 280 families and children that avail of the service here, and we provide medical surveillance for those children and their families. And also I am the contact person then for any queries that parents might have in between appointments.
You're kept very busy, Fiona, I can tell. Can you tell us a little bit about some of the common medical needs of individuals with Down syndrome that maybe other healthcare staff don't know about?
Of course. So there are national guidelines for screening people with Down syndrome for certain medical conditions which are more prevalent. We're in a very fortunate position, I suppose, that we know exactly what medical issues some people may present with, and also some issues that they may be more likely to develop at any stage during their lives. So things that we kind of think about are in relation to their hearing. So we know that about 75% of people with Down syndrome will have problems with their hearing at stages during their lives. Some people may have conductive hearing loss, whereas there's fluid in the ears, which is the most common type of hearing loss. But we also know that there can be some conductive issues, sensorineural issues that people present with as well. So we really need to make sure, and I know that speech and language therapists in early childhood, it's so important to make sure that hearing is at optimum levels in order to allow for speech and language development and acquisition of speech. And that obviously plays a big impact on how they communicate going forward and how they're able to hear what people are saying and also to be able to communicate effectively as a result. So we carry out regular hearing screening. So we carry out hearing tests on children up until the age of 5 every year. And then going forward, we screen every year then afterwards, every 2 years, going forward then.
Okay.
Other things that we need to think about as well are things like eyesight. So we know that 50% of people with Down syndrome will have issues with their eyes. Things like long and short-sightedness are problematic, and a lot of people will need glasses. So again, regular screening and making sure that they are able to see correctly is very important.
Absolutely.
Also, we do annual blood screening, so we carry out tests for things like hypothyroidism. Again, about 10% of people with Down syndrome will have problems with the thyroid gland. The thyroid gland produces a hormone that's important for growth and development. If there is a problem with the thyroid, people will present with tiredness, low energy levels and weight gain. So again, we need to really keep a closer watch because we know that people with Down syndrome are more prevalent to having problems with the production of the hormone from this gland. Also, when we're doing the annual blood tests, we also carry out things like full blood counts and iron levels, vitamin D as well, which has a big impact on bone health, and especially going forward in relation to things like osteoarthritis and Down's arthropathy. Vitamin D levels are really important that we check them just to make sure that they're at the right levels. Things like sleep apnea are really prominent as well. So a lot of people will present in early childhood with symptoms of sleep apnea, such as snoring at night time, disruptive sleep, and positional sleeping. So again, we kind of follow the American guidelines where we screen children before the age of 4 for sleep apnea.
Very good.
If we do pick up sleep apnea in early childhood, we think about if the obstruction is fixable, so things like tonsils and adenoids, which might be larger in children with Down syndrome. If they can be removed and the problem can be fixed, we generally carry out that procedure in early childhood. Again, it can present in later life. Again, if there's problems if the adenoids, which can be prone to growing back, they can be causing sleep apnea symptoms again. So again, it's just keeping a close, watchful eye on that. If the cause of the apnea is not seen to be obstructive, it can be some things like muscle tone, which we know that people with Down syndrome have lower levels of muscle tone, and also things like obesity as well can lead to the development of sleep apnea going forward. So if there is no obstructive reason for sleep apnea, we're going to be thinking about things like weight management and other lifestyle preventatives which can improve that condition. Oral health as well is really important, and we continuously tell families to bring their child to the dentist on a regular basis in order to have their teeth checked. It's really imperative that they have good oral hygiene in order to retain the teeth they have. And we also know that people with Down syndrome, there is HSE guidelines out there in relation to oral health, that they do have issues that are different to people without Down syndrome in relation to overcrowding and other dental issues that can present in early childhood.
And it strikes me, Fiona, that there's a lot of things to consider. And I know that within CHI, the Children's Services, there's a lot of collaboration. And I suppose I'm very interested in what happens when a child transitions into adult services. Can you tell us anything about how all of these health issues are followed up or what happens during that process?
Yeah, it's a very daunting time for families, especially parents, with that transition piece and that difficulty with being discharged from paediatric services. So as you mentioned, we have a good kind of multidisciplinary team that surround us and are very accessible to us. And that in itself makes things quite easy for families. Unless a person with Down syndrome has a complex medical need, a lot of the times what we do is discharge them back to their GPs. So it's giving the information back to the GPs and giving them the information of what needs to be done going forward. So again, if a child has been linked in with paediatric services for quite a long period of time, sometimes the onus is taken off the GP because a lot of the tests are done by ourselves. But we need to, I suppose, actively communicate and start the conversation early with families. So usually around early teenage years, 13, 14-year-olds, we start planting the seed with families and telling them exactly what's going to happen going forward, and also empowering the child and telling them what kind of health checks they will need going forward. And relieving the anxiety, I suppose, and discussing early planning from an early stage for that transitional piece to try to alleviate the worries that families to have at that time. So we, a lot of the times, give a lot of written information to families, and we also go through that information as well, verbally with families, and just let them know exactly what their child will need. We might give them a copy of the guidelines that are available online and just kind of give them the roadmap of what needs to be done and when it needs to be done. We'll also communicate in writing to the GP, letting them know a good synopsis of their health and what has happened when they've been a patient of the service here at CHI, and then going forward exactly what that person will need. But it is a very difficult time, and we recognise that. And again, that follow-up piece of having somebody at the end of the phone to ring if they have any concerns, just to guide them through.
Yeah, okay. Thank you. And Fiona, is there anything that you think our listeners should hear from you that I haven't asked you about today?
Well, I suppose it's just being very mindful that the vast majority of people with Down syndrome don't have any health issues. and also the importance of screening to prevent any further issues. So it's our role, I suppose, as health professionals to oversee that things are checked and monitored, and everything that may present in either childhood or adulthood is very treatable and very manageable. And it's having open communications, and that support for families is really vital to troubleshoot these things before they become problematic.
That's brilliant. Thank you so much, Fiona.
Thank you.
Thank you so much to our contributor, Fiona, this week. We discussed many resources during the course of the podcast that you might wish to access. We have set up a link on the TUH University Hospital website where you can read and learn more. Thank you for listening. In our next podcast, we will be joined by Suzanne Kennedy and Fran Kane. Suzanne is the Acute Intellectual Disability Liaison Nurse in TUH University Hospital, and Fran is the mother of an adult son with Down syndrome. She is also a member of the hospital's Patient Community Advisory Council. We will discuss tools and strategies to improve access to health services for adult patients with Down syndrome.